Good day everyone, my name is Darren Nicolas and I'll be your host for today's talk. It's a great pleasure for me to introduce our speakers today who are going to talk to us about the principles of bioethics. Our first speaker will be Miss Juliana Aguillon, who's going to talk about the principle of double effect, and our second speaker will be Miss Jose, who's going to talk to us about the principle of non-malifecence. Let's begin first with our first speaker, Miss Juliana Aguillon.
Thank you for inviting me, Mr. Nicolas. One of the basic principles of bioethics is the double effect principle. It aims to provide a set of guidelines in determining when it is permissible to cause harm as a side effect or a double effect of bringing about a good result, despite knowing that the action itself can also bring about bad results. There are 4 conditions to be applied in this principle: that the action itself from its very object be good, that the good effect be intended and not be produced by means of the bad effect, and that there be a grave reason for permitting the bad effect.
Can you cite some examples or situations in a clinical setting where we can see the basic double effect principle?
A situation where the double effect principle can be seen is when a doctor facilitates euthanasia. In this case, the doctor administers medicine with the intent to relieve the patient's distress. However, it is important to take note that a doctor does not do wrong to a patient when he or she harms him to benefit him with the patient's consent.
How about abortion? Is it also an example of the basic double effect principle?
Yes, abortion is another great example of the double effect principle. In this case, a pregnant woman must decide whether to abort the child or continue a risky pregnancy to term. In both of the scenarios I have mentioned, death is then a side effect of the good result, not the means of achieving it.
Thank you for sharing your insights, Miss Aguillon. Now let's move on to our next speaker, Miss Jose.
Thank you for having me. I feel delighted about being here. Second on our list that I'd like to talk about today is the principle of non-malefacence, a term in clinical ethics derived from the Latin axiom primum nocere, an umbrella term which holds that anyone should not commit crimes, kill, or intentionally hurt or take away the pleasure of another person. It stresses how not harming another individual should be of prime importance. In medical ethics, it directs physicians to do no harm to their patients. Therefore, they should avoid providing ineffectual treatments or acting with malice towards their patients, as these offer risk with no possibility of benefit, and thus have a chance of harming the patients. This principle, however, offers minimal valuable guidance to doctors and medical personnel, since numerous promising treatments likewise have serious risks. The moral issue is whether the benefits outweigh the burdens.
What are the medical scenarios concerning the principle of non-malefacence? What are its importance and purposes?
For instance, in medical clinics or hospitals, giving vaccines to children can cause pain. However, vaccinations provide protection against extreme infectious diseases. Thus, the advantages of the act outweigh the minor harm inflicted.
Thank you for your time, Miss Aguillon and Miss Jose, and to everyone who is watching right now. I hope you'll have time to reflect and dig a little deeper on the topic that our speakers discussed a while ago. Again, my name is Darren Nicolas, and tune in for our next talk. Bye!